Good morning. Can you hear me okay? Okay, good. Hi there. I'm Bob Chapman. I'm the Vice President for Vancouver Community for Vancouver Coastal Health. I want to say good morning and welcome to you all. Bonjour, bienvenue. It's a beautiful wet morning in Vancouver in this gorgeous atrium where we have the totem poles around us. And I want to start by doing a land acknowledgement and recognize that we're currently here today on the unceded traditional territory of the Musqueam, Squamish, and Tsleil-Waututh people. And for that, I am very grateful. We want to welcome you for some announcements today, and we're going to be hearing from the Honourable Mark Holland, Minister of Health for Government of Canada, the Honourable Harjit Sajjan, President of the King's Privy Council of Canada, Minister of Emergency Preparedness, and Minister responsible for the Pacific Economic Development Agency of Canada, and then Honourable Adrian Dix, Minister of Health for British Columbia, and Jennifer Whiteside, Minister of Mental Health and Addictions for British Columbia. Following our speakers' remarks, we'll be inviting Mr. Holland and Mr. Dix back up for some signing of some bilateral agreements over here. And following this, we'll be opening up the floor to media and some questions and answer period. We will have a combination of live questions and some people online. And it's now my pleasure to introduce Mr. Holland up to the podium. Thank you.
Thank you so much, Bob. Merci beaucoup. C'est un grand plaisir d'être ici aujourd'hui. This is an exciting day, and I'm very happy to be with you. Bob, I want to start by also acknowledging that we're gathered on the unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I want to acknowledge also some of the folks that you already mentioned, Bob, to say how happy I'm to be here with my counterpart, Adrian Dix, who along with Jennifer Whiteside are doing tremendous things in healthcare here in BC, and very excited to continue that partnership and continue working together. As well, you've already acknowledged my good friend, Minister Harjit Sajjan, who is going to be speaking in a few moments. I also want to acknowledge a couple of my colleagues who are here, Patrick Wheeler, who is here, Wilson Mao, who's also here, and doing a phenomenal job of representing their constituents. I know we're very excited about today's announcement and what it's going to mean for all folks here in British Columbia. Also, Don Davies, who is the member of Parliament here with the New Democrats, but also the health critic, who I get an opportunity to work with very closely, and appreciate your presence here today, Don. On behalf of the Canadian Nurses Association, we have Angela Wingle. From the College of Family Physicians of Canada, we have Clayton Dick. From the Digital Supercluster, we have Sue Payesh. And I also just want to say thank you to the Vancouver General Hospital for hosting us today, and for all the folks who are here today serving British Columbians as healthcare professionals in our communities. Les Canadiens et les Canadiennes comptent sur un système universel de soins de santé financé par l'État. C'est un modèle de couverture universelle qui fonctionne depuis des décennies. Cependant, comme vous le savez, le milieu des soins de santé évolue. Il compte l'ensemble qui ont été aggravés par la pandémie COVID-19. Look, folks, today, too many Canadians don't have a relationship with a family doctor. They don't have access to a regular family health team they can count on throughout their life's journey. As a consequence, they rely all too often on walk-in clinics or emergency rooms. Worse, they are discouraged from going in early. They miss that appointment that catches a symptom or a problem while it still can be fixed. They never have that initial conversation before it becomes a physical problem that can't be overcome. These relationships aren't just about convenience or ease of access, they're about prevention. And it's absolutely key to transformation. Whether provided by a doctor, nurse practitioner, pediatrician, or multidisciplinary team, family health services are essential. It is essential for your regular care that you aren't walking through the door at a strange place to get care from an unfamiliar face. You need a relationship in your community with people who know you and your health journey. You need local care from people who know your story and have the support, time, and resources to passionately care for and about you. That is the health system that we all know we need. That is the system that will kill misinformation. That is the system that will catch illness before it becomes deadly. And that is the system, along with strong community support, that will save untold billions of dollars by stopping illness before it starts. Said plainly, it is the system that will keep our moms, dads, brothers, sisters, cousins, family members, children healthy and in our lives. Look, the pandemic was brutal. It was a trauma that was collective, and it pushed back optimism and allowed some to peddle despair. The backlog in hospital procedures grew over those dark days, and many forms of care were delayed or canceled. We are still trying to catch up, even as it has left everyone feeling tired, stretched, and under-resourced. Our healthcare workers, like those of you who are here today, have gone well beyond the call of duty to keep our community safe and healthy. And I want to stop here to take a moment to say to the healthcare workers here and to those that are in British Columbia and across Canada, that we see you. The sacrifice that you have made, the amount that you have given and continue to give is absolutely incredible. But it isn't just acknowledging that. When our days were most dark and our future was most uncertain, you did not waver. You set aside your interest and put the well-being of your neighbors and your community first. The only question asked, the only action taken was what was right and what was needed. You inspired us. Barriers and egos evaporated, walls and rules fell, partisanship and jurisdiction were waved away, and your spirit, your sacrifice called us to be one team. You lit inside us something I have never seen before. Total cooperation. And that's what it's going to take to transform our healthcare system. It is that spirit, your spirit, that we must call upon now. You showed us what is possible when we can work as one. You showed us what we can accomplish when our differences become opportunities to get results rather than turf to squabble over. It is that spirit I feel in the system today. Yes, so many are tired and too much has been asked. It would be easy to give up. But that sacrifice, that pain, has also illuminated a way forward. For the first time, a path to total transformation can be seen. I know it is hard to be optimistic. We are living through some of the hardest times in human civilization, and that certainly is taking its toll. I know that 1 in 3 Canadians say they are struggling with their mental health. We don't get to better health unless we take this on. Every one of us. In our homes, in our workplace, and yes, in our health system. In this hard hour, we must be there for each other. We must lift each other up, and we must have a system that is equal to that need. I know that Minister Dix and his government is committed to this truth, as is ours. This is not going to be easy, but we must face it honestly, and we must face it together. We must lead knowing there is no health without mental health. And if Minister Sachs was here with me today, I know how much he would agree with that statement. All chronic disease and illness have as their biggest underlying cause mental health. Our greatest opportunity to expand productivity and innovation rest in mental health. From the safety of our communities to the lead cause of crime, mental health is at the center of every solution. It is at the core of all of our opportunity. A terrible manifestation of this mental health challenge is that Canada is facing an unrelenting and tragic overdose crisis. This is one of the most serious public health crises in our country's history, and BC is on the front line. We must attack the root causes while doing all we can to help those who are suffering. Canadians need better access to mental health and substance use services as part of publicly funded care. We must have an honest and open conversation about what we need and about our pain. Our system must improve, but so too must our compassion for one another. We all must lift the kindness with which we treat each other. Our workplaces and homes need to be places of support and joy. Transforming our health system isn't enough. We must put positive mental health at the heart of every interaction we have, every transaction we have. If we get mental health right, we get everything else right. Finally, before I talk about the announcement here today quickly, I want to say, in a society where just about everything you could imagine is accessed electronically, most patients don't have access to their own digital health information. I know that Minister Dix agrees with me that this is unacceptable. Information is not always shared electronically between health professionals, resulting in duplication of tests, prescription challenges, increased costs, increased safety risks, and frustrations for doctors and patients alike. How our systems communicate, ensuring the data is shared and available and that we knock down barriers for using data is essential for transformation. Je viens de présenter quelques des principaux défis auxquels notre système de santé est confronté. Le Canadien et les Canadiennes méritent le meilleur soin de santé et notre gouvernement est déterminé à travailler avec les provinces et les territoires pour renforcer le système de santé. To do this, the Government of Canada is investing nearly $200 billion over 10 years through the Working Together to Improve Healthcare for Canadians plan. This historic support includes $25 billion to provinces and territories for tailored plans that will focus on the unique needs of people in each province and territory. It will advance shared health priorities, and it is the critical foundation for the transformation I spoke about earlier. These dollars are about expanding access to family health teams, about working to ensure that everyone has a relationship with a family doctor in their home community, be that rural, remote, or urban. This money is about supporting healthcare workers and reducing backlogs. It's about increasing mental health and substance use support and modernizing healthcare systems. Today, I'm pleased to announce that Minister Dix and I will be signing the first bilateral agreement under this plan. This agreement will see $1.2 billion flow from the federal government to British Columbia over the next 3 years, marking in the first investment in what will be a 10-year plan for collaboration. This is concrete evidence of our two governments' commitment to health transformation. It is a key building block of the change that will see us go from one of the best health systems in the world to the best health system in the world. Dans le cadre de cet accord, la Colombie-Britannique utilisera des fonds fédéraux pour faire progresser les efforts déjà en cours dans le domaine prioritaire commun. Let me just give a few examples of exactly how this funding will improve health services for the residents of BC. This plan will develop an innovative model of care at 83 acute care sites throughout British Columbia, so nurses can spend more time with patients. It will help retain our best talent. It will help recruit the people we need. It will ensure folks can access the local care they need where and when they need it. Practically, it will reduce diagnostic and treatment backlogs. It will also mean more prevention, more early conversations, and more bad health averted. It will increase access to mental health, substance use, and addiction services, where BC is already a leader and already doing so much. It will double the number of Foundry centers across the province in the next 3 years from 16 to 35, so BC residents can find someone to talk to, get support from a care worker, and connect with experts who can help navigate health and social services, resources, and programs. It will modernize the healthcare system so patients and healthcare professionals can securely access their health information to improve their care. You know, fewer than half of the patients in BC can access their personal health record. In the next 3 years, this plan will increase that to more than 75% of the population. Je vous ai donné quelques exemples de changements concrets que les résidents de la Colombie-Britannique verront au cours des 3 prochaines années. Le ministre Dix parlera des autres résultats attendus. But an essential part of this agreement is making sure that we can show progress and not just talk about it. Show it in data and make sure patients feel it in better care and outcomes. We have published the action plan along with concrete targets for this $1.2 billion investment online at canada.ca, and British Columbia will report publicly to its residents on progress the province is making to achieve its targets each and every year. In conclusion, I want to thank Minister Dix, Minister Whiteside, along with my parliamentary colleagues, and say this agreement starts the first of 13 to kickstart our efforts to build the best health system in the world. We start here as BC is already a leader. They are showing us a way forward, and I'm deeply excited for the incredible work already underway and for the transformation that lies ahead. Our partnership will deliver measurable results to patients across the province that will be felt and seen. This certainly includes essential progress for Indigenous people and other underserved and disadvantaged populations. Notre objectif collectif est de renforcer le système de santé pour les populations canadiennes et de veiller à ce que chaque personne reçoive le meilleur soin possible. I know the agreement that we're signing today is going to make a real difference in the lives and the health of British Columbians. Now let's go make this change happen. With that, it's my pleasure to introduce my friend, the Minister and Member of Parliament here in British Columbia, Harjit Sajjan.
Good morning, everyone. I too would like to start by acknowledging that we are gathered here today on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And it's always great to see my good friend, Mark Holland, the minister here in my hometown, making such a momentous announcements, and also alongside Minister Dix and Minister Whiteside from the provincial government as well. And also, again, a big thanks to VGH for hosting us here today. I know the wonderful work that all the doctors, nurses, and the support staff, that the work that you do. Anybody who lives here, you have touched our lives. So thank you for that work. And as always, this place is pulsing with activity as you care for our community. The compassion and professionalism that you show your patients represents the beating heart of our healthcare system. And I'm here today representing my colleague, the Honorable Yara Sachs, the Minister of Mental Health and Addictions, and Associate Minister of Health. And today's announcement demonstrates how the Government of Canada and the Province of British Columbia are working together to support all of your efforts. As Minister Holland mentioned, the agreement that will be signed today signals the beginning of increased federal health transfers to BC for the next 10 years. And I'd like to speak for a moment about what that means for mental health and substance use services. As all you know, the need for these services are growing. COVID-19 pandemic, along with an increasingly toxic and unpredictable illegal drug supply, have brought the situation to a crisis point. And for those who are struggling, for those who have loved ones who are struggling, help cannot come soon enough. Mental health is health. And through this agreement, we will be working with British Columbia to integrate mental health and substance use care as a full and equal part of our universal healthcare system. The agreement that will be signed today will see a total of $246 million invested in mental health and addictions over the next 3 years. And that funding will be used to ensure that people get the help that they need, when and especially when they need it. This includes reducing wait times for mental health and substance use services, expanding the number of Foundry centers, as Minister Holland already said, from 16 to 35 across the province. And these sites offer a wraparound support for youth, from health and social services to compassion support and support our communities. By meeting people where they are, we can make sure that everyone has the support needed to stay healthy and well. And through this agreement, we will strengthen the capacity of family health providers, reduce substance use harms, and expand virtual care for youth. Now, this will improve access to quality and timely mental health care and substance use support. And also, my wife is a family doctor and works about a block from here. And I can assure you, when she found out about this announcement, she had said, you know what, as family doctors, so it's difficult to find services for your patients. And you know, she's talking on behalf of all family doctors who are trying to take care of their patients. And this funding will go a long way to giving family doctors the tools they need to be able to look after their patients as well. And as myself, as a former police officer, I remember bringing people here when it came to mental health issues, because sometimes the police were the last word. I remember sitting here in the Emerge Center with a lot of folks until somebody could be seen. It takes resources off the street. So this is a very big deal for BC, and it's going to have an amazing impact. The people of our province expect to have the access to essential mental health care when they need it, and they deserve nothing less. And the government of Canada will continue to work with British Columbia and all the provinces and territories to make this a reality. Thank you.
Thank you very much, Mr. Holland, Mr. Sajjan. It's important, wonderful to be here on the territories of the Musqueam of the Squamish and the Tsleil-Waututh First Nations. I'm Adrian Dix, I'm BC's Minister of Health. And I'm really pleased to be here today to make this announcement. This is something that Minister Holland and I, when he first became Minister of Health, committed to, Federal Minister of Health, which is getting this done, getting to work together. I think over time, there have been important and significant Canadian debates about federal and provincial jurisdiction and responsibilities with respect to healthcare. But what this signals is our determination to work together for patients, for people working in healthcare, for the community, to make a better public healthcare system in Canada. And that's our determination together. I want to thank you for coming out today. It's early morning. You and I got to be in Charlottetown soon. You've taught me something as someone from British Columbia, that you can wear Converse All-Star basketball shoes to an announcement. So I really appreciate that. I really appreciate that. That's going to liberate me in future, and I appreciate that. And I hope I hope people don't mind my $50 dress shoes. In any event, I think this is an important day in BC. We've been living really since the beginning of 2020 with the COVID-19 pandemic. Today, our public vaccination program, this fall's public vaccination program for COVID-19 and for influenza begins. Today, across British Columbia, 30,000 people have made appointments and will be getting appointments to get their vaccination. To date, thousands of healthcare workers and people in long-term care have already received their vaccinations. Approximately 750,000 vaccination invitations have gone out to people in BC. About 100,000 appointments have been made for this week and more in future weeks. And we encourage people, when they get invited, to book their appointment and get vaccinated. Vaccinated against COVID-19, vaccinated against influenza. We are living in this space with this challenge of COVID-19. The concurrent challenge of the public health emergency that is the overdose crisis over the last number of years, and what we can all do at this time together, what we can all do together to contribute and to help one another, to help those that we love and those that we don't know, and especially to help those people who are working here in healthcare, is to get vaccinated. And I strongly encourage people to get involved in that campaign and take all the actions they can to limit the spread of respiratory illness in this winter, when we also will be delivering record numbers of surgeries and record numbers of diagnostics exams, and see record numbers of people in our public hospitals. It is important for us all to do, and I strongly encourage you to do that. Everyone now in BC understands our system. BC, they'll get their invitations. When you get your invitation, please book your appointment. At the core of healthcare is the people who work in healthcare. And that's the central feature of our response to the challenges facing healthcare today, which is the Health Human Resources Plan, which is critical for all elements of healthcare, including what my colleague Minister Whiteside was speaking of with respect to mental health and addictions. Last September, we launched our Health Human Resources Plan with 70 actions, and it is already making a significant difference. Since January of this year, just January of this year, 5,221 net new nurses in British Columbia, net new in the first 8 months of the year. That goes through to Labor Day. Since January of 2023, 524 new international medical graduates, specialists, primary care, and academic physicians have come and been registered in British Columbia and are working here. As of September 28, 2023, 3,729 family physicians are practicing under the new longitudinal family practice compensation model which has transformed primary care, something people said couldn't happen. They said we couldn't move from fee for service. It was 80% of our system. We did it in a matter of months in BC. And the impact of that, the incremental new doctors that are coming into the system or returning to primary care is making and will make a significant difference in our community. Of new doctors, 207 family physicians have now signed the new to practice contracts. 196 nurse practitioners are on contract to work in primary care in BC. In terms of healthcare aides, thousands, and you saw some of them here in our programs in long-term care to greet people as they visit in this respiratory illness season, thousands of people working in infection control. And in addition to that, 6,546 healthcare assistants in our HCAP program, which has been transformative, perhaps the most successful health human resources program in the history of BC, launched during the pandemic and delivered during the pandemic. Over 8,000 new healthcare workers, 7,000 were promised when the program was launched over 3 years in September of 2020. There's all of these changes taking place, and we need to do more. We have added, since I've been Minister of Health, tens of thousands of new healthcare workers. And all that means net, 38,000 net. And we have to do it again in the next 5 years, and again in the 5 years after that, replace all the people who are retiring in what is overall an aging population that affects healthcare, and add that many more. And to do that, we all have to be pushing in the same direction. It's why what Minister Holland said is so important. We are building new cancer centers in Surrey and Burnaby, in Nanaimo and Kamloops. And we need to build out the staff to serve people and to treat people at those centers. We have 16 major new hospital projects in BC, 16, including not far from here, a new St. Paul's Hospital that we've been waiting generations to build. It's going up not far from here. We need, of course, to continue to build the staff to support acute care and primary care, to support all of the new mental health and addictions programs that have been put in place. And that's what makes, I think, this agreement so fundamentally important to helping us build that. We are seeing an unprecedented budget year in BC for healthcare, 8.9 billion over 3 years in the most recent budget tabled by my colleague, the Minister of Finance. 6.4 billion essentially for caseload and for mental health and for primary care and the Health Human Resources Plan in that budget. And the money we're talking about today, which is in addition to other parts of the agreements that we've signed with the Government of Canada, this $1.2 billion will be central in adding to that over the next 3 years. And specifically in British Columbia, we are using it in the first 3 years, and you see this in the agreement, to support all the work we're doing with nurses in British Columbia and the BC Nurses Union to address and implement, I think, a historic change as important as the change with doctors has been recently made for nurse ratios in acute care. And you see when we announced 200, then 250, then $300 million supported by this agreement, what a difference that will make in acute care across the province. Minister Holland have talked about the investments in digital health and the need to empower patients and healthcare providers to be able to work more closely together. The important agreements to address all of the things that we've done with respect to wait times. You see going from near the bottom of the country to near the top of the country over the last number of years. We have to continue this effort on surgeries and on diagnostic care. And we will continue to do this. This agreement supports that as well. And finally, and my colleague will speak about this in a few minutes. My colleague, Minister Jennifer Whiteside, will speak about mental health and addictions. $246 million of this agreement goes to mental health and addictions. That's 82 million over in each year over the next 3 years. And Minister Whiteside will talk about that initiative as well. In short, I think there has been, I believe, lots of talk about these issues. And what I'm saying and what we've been saying in BC with all these changes, which in the history of public healthcare are important and radical changes that have been developed with our healthcare professionals and our healthcare unions, with our healthcare workers and with the whole community, with Indigenous communities in particular, the implementation of the Implementing Site report and all the changes that are being made and implemented in Indigenous primary care. The time for talk, for debate, for discussion is over. This is a time for action. And that is what I think the message that Minister Holland has carried today, that is the message that I continue to deliver here in BC. And with us working together in one place, not arguing, but working together on a fundamental goal to improve public health care, I think this agreement can help us make a big difference. It's now my real honor to introduce my colleague, the Minister of Mental Health and Addictions, the member of the Legislative Assembly for U.S., Minister Jennifer Whiteside.
Thanks very much, Adrian. And it is such a pleasure to be here today on the traditional territory of the Musqueam, Squamish, and Tsleil-Waututh peoples with my good friend and colleague, Minister Dix, with Ministers Holland and Sajjan. Thank you very much for being here. And thank you to Bob and to the leadership for Vancouver Coastal and VGH for hosting us today. And I do want to send a special shout out and express deep gratitude to all of the healthcare workers, the advocates who are watching this announcement, because your work is extraordinary. Your advocacy for our public healthcare system is such an important part of how we make gains, how we build a healthcare system that works for everyone. So thank you. Thank you so much for your work. And by extension, I'll acknowledge Minister Sachs as well for her work on this file. It is really fitting today that we're gathered together. It's World Mental Health Day. And this year, World Mental Health Day is focused on mental health as a human right. And I think increasingly, we are also understanding that mental health is physical health, mental health is healthcare, mental health has to be integrated and part of our healthcare system. It is a powerful theme that resonates in the joint commitments that you see in the work that we are doing together with provincially and federally. Mental health care isn't just about services and systems. It is about recognizing that everyone has the right to mental well-being. And it is, as all of my colleagues have addressed, an important opportunity to stop, to pause, and to reflect on the degree to which the past few years have tested us, our families, our communities in ways that we had never imagined. The COVID-19 pandemic was a great disruptor. It fundamentally disrupted people's access to healthcare, people's relationship to primary care, our relationships with each other. And that is what we are working hard to rebuild. So from the COVID-19 pandemic to the impact of extreme weather due to climate change, to global uncertainty, and of course, an unrelenting, vicious, toxic drug crisis that is killing thousands of British Columbians and Canadians. These are difficult times, and these challenges touch all of us. So the commitment that is before us today, and this funding is a significant part of what we need to do together in order to ensure that we are responding to the needs of British Columbians and the needs of Canadians. Our government in this past budget invested $1 billion for mental health and substance use care across the whole continuum so that we can continue our work to ramp up access to treatment, access to counseling, access to those pathways that are so important through primary care, access to harm reduction so that we can keep people alive in order to connect them to care and support. That is a fundamentally important effort that we are making to keep people alive so that we can connect them to care and support. And so the efforts that we are making upstream on child and youth mental health, opening foundry centers, which are really excellent primary health care, including mental health care for youth, ages 12 to 24. investing in working with school districts and with our child and youth mental health system to ensure that children and youth have better access to care and to wraparound support so that we can catch smaller problems before they get bigger. All of these are critical projects that we have and that we have committed to working on collectively. And I'm grateful for all of the work that is being done across our healthcare system, across our mental health care system, with our colleagues federally, everyone provincially, because this is a time when we need to work together as we have never worked before to address the challenges that people in our communities are facing, to ensure that people have access to the care that they need. So it's with all of that, with heartfelt gratitude to healthcare workers, to the leadership, to the advocates, to my colleagues, that it's truly an honor to take part in today's announcement. Thank you.
Thank you very much to the four ministers for your remarks. It's such a privilege to be part of the announcement here today. We're now going to ask Minister Dix and Mr. Holland to join at the table to do the signing of the bilateral agreement. So if you wouldn't mind stepping up.
Yeah. It depends your perspective, from their perspective on the right. Okay. Yeah. Boy, you got that. Pretty fast. So we're going to do this with Jennifer and Harjit Sajjan. Excellent. Okay. Now, Jennifer, you're on the left. Harjit, you're on the left. You're gonna go back here. Now. Gotta do some work. Gotta do some work here, Bob.
No,
Are you gonna take all the questions today?
I'm going to have the privilege of passing that to some of you.
I like that. I like the thinking. I think Bob should take over.
I'd like to welcome Mark Johnson with Health Canada to open up the media questions and manage the questions both online and in the room. And this concludes my part of being the MC. So thank you very much.
Oh boy, we'll be calling you.
Thanks, everyone. We'll start with media questions here in the room. If you're a journalist and have a question, please approach the microphone. You can ask a question and one follow-up. And please identify your name and your outlets and to who you're posing your question. Nous allons maintenant prendre les questions des journalistes ici dans la salle. Si vous êtes journaliste et vous avez une question, merci de venir ici au micro. Vous pouvez poser une question et un suivi. Et on vous prie d'identifier votre nom et votre média et à qui vous posez votre question. See, we'll get started here.
Good morning. This is Penny Dafflos from CTV News. I want to know what this money is going to do to address the health human resources crisis. Again and again, we keep hearing that personnel is one of the big roadblocks to people getting treatment for all sorts of things. Throwing money at the problem isn't solving it because we keep hearing from healthcare workers these careers are unsustainable. So it's not just about paying them more. Of course, they'd like to be paid more, but what is this funding going to do to make these careers more sustainable so that people can get the help that they need?
Go first.
Well, thank you for the question. And first, let me acknowledge that absolutely, money alone we're not holding this out as a panacea. That the challenges that we have with respect to workforce are real. And that what we need is transformation of our system. We need to work collaboratively when we're talking about our immigration system, or when we're talking about those that are responsible for credential recognition, to make sure that we reimagine things in a way that opens up our potential. And I see here in BC, Minister Dix will speak to this in a moment. You know, this is one of the first places I came to when I was health minister. I came to BC within a very short time, a few days of me being health minister, recognizing there are remarkable things happening here with workforce, and that the changes that Minister Dix and his colleagues are bringing about, I think, are at the core of the transformation that we need. I was just in Nova Scotia talking with the Nova Scotia College of Nurses there about the profound changes they're making to bring in folks from other parts of the world, to speed up their recognition process, to make sure that as people come from different jurisdictions that they're nearly instantaneously recognized. And what I'm saying is that along with the dollars that are here today, and with that transformation, I have enormous optimism that we're going to be able to meet the challenge of our health workforce needs. But I'll turn it to Minister Dix.
Well, I think over the summer, as you know, I went to about 25 hospitals, for example, and met at length with healthcare workers. And we had this discussion because we have an unprecedented number of people working in our healthcare system. Had an increase of 38,000 workers net new. So I'm Minister of Health. I asked people that question: does it feel like 38,000? Everyone says, "Oh, it doesn't feel like 38,000. It doesn't feel close to that." Right? And so what do we have to do? We have to take all of the actions you see in the Health Human Resources Plan. That means training more people. We added 602 nursing spaces, 336 allied health positions, the HCAP program, the most successful Health Human Resources program we've seen. We're adding 128 spaces in medical schools in BC, and adding a new medical school, the first one in Western Canada in 2 generations. That's the training side. We got to make it easier for internationally educated healthcare professionals to work here. And you see this especially on the side of doctors. We're going to more than double what we did last year. And last year was a record year for new international medical graduates. Our PRA BC program, which really helps in particular in rural BC, we're tripling it, and we're meeting those targets. That's an important step. On nursing, the same thing, thousands of new nurses through that system. And in fact, this year, 5,221 net new nurses in healthcare in BC, which is an extraordinary achievement, I think. So we got to do that. We have to change the way we deliver care. So the changes we've made, both in the way we pay doctors and support doctors in our system, the way that we allow people to work to the full extent of their scope of practice is important. Hundreds of thousands of people have already benefited from the changes we've made in expanding the scope of practice to pharmacists. So that's an existing workforce that is able to do significantly more. We've also made some specific changes in collective agreements, such that since April 1st, 61 new oncologists have been hired in BC, 61. And we have more to do, but 61 is significant in a short period of time. On the base of oncologists, we have 27 radiation specialists in BC since that time, with more to come. So you have to take all of the steps. But I think what makes what we've done in BC unique is the extent to which we've worked with our doctors and nurses and health sciences professionals and healthcare workers to work on these goals. We've seen progress. We got to do more. This agreement's about driving that agenda.
Just to follow up for Minister Holland, it says in the release that there's going to be annual check-ins to see that the benchmarks and that the goals are being reached. That there's going to be an annual report at least. Are there going to be more frequent check-ins? Because this is a lot of money. And if it's a 3-year program, checking in 3 times, you know, it doesn't necessarily say that we're on the right track. So are you going to have a regular dialogue with the provinces? Like, what's your expectation in terms of showing that the province is on track to spend this money the way that you expect it to be spent?
Well, you know, I've been health minister for about 2 months. This is my second visit to BC. Minister Dix and I talk all the time. I'm going to be here all the time. This is an ongoing collaboration. We are committed to working collaboratively, and I think that's what you heard here today. We're not interested in turf or barriers. This is about an ongoing iterative process of collaborating and finding ways that we can improve our health system. What can we do to make things easier? Folks talk to me about how difficult it is for doctors, as an example, to fill out some of the forms that are required for CPP disability or for sick leave or for other administrative work. How can we cut that down even just a little bit? How can we work with provinces to look at the way our two systems interact and make sure that we reduce latency, that we reduce duplication, that we make things logical. Yes, you're right that they're on the website. You're going to see regular reporting, but it's about a partnership that's much more profound and much deeper. And, to give a sample of that, tomorrow I'm going to be going to meet with health ministers in Charlottetown, where we're all going to be getting together to talking about these workforce issues and how we collaborate and how we can learn from each other. And my goal is to be a champion. We want to race to the top where I see things that are working. When you talk about the super cluster here built around St. Paul's, the incredible things that are being done, I'm just blown away. And I say to myself, like, this is a model that we have to replicate and we have to take elsewhere. So when I come here and I'm with Minister Dix and I'm talking to the folks that are invested in this transformation that's happening here in BC, continual championing of that, talking about it. As I said, the conversation that I had with the Nova Scotia College of Nurses, I look forward to having the one here in BC. But there's incredible things happening in this country right now. So it isn't just about the reporting of data and numbers. It's about highlighting, underlying, and throwing up into the air so everybody can see the successes as a marker for us all to charge towards, and to say, why aren't we going there? Why aren't we doing this? Why can't we be better? So it's an ongoing process.
Thanks so much, Brianna Charlebois, Canadian Press. Minister Holland, I'm just wondering if you have any updates on the situation as it stands with Quebec.
Well, thank you. We're moving through province by province. This is the first, and the conversation with Quebec, is going to be ongoing. Look, I get that we want to think about jurisdiction and we want to protect jurisdiction, but at the end of the day, health is health. And we all have a responsibility to find ways to work together. And this is what it's about today. I'm not looking to walk around with a stick and be aggressive towards provinces. I want to work with provinces and territories. I want to find solutions. So that isn't about intruding on jurisdiction. It's about being partners. Je pense que les personnes qui habitent partout au Québec veulent un système de santé qui marche bien, qui peut augmenter leur niveau de santé. Et c'est pour moi, c'est clair que c'est absolument essentiel que le gouvernement fédéral et les provinces de Québec travaillent ensemble avec cette boule-là. And so, I get it. There's old instincts, right? We want to protect turf. We want to protect jurisdiction. We want to protect our political interests. We can't afford it. And I take it back to the spirit of the pandemic. There was that brief moment, and we all felt it. I was the House leader. And there was a brief moment, even politically, where we said, we can't afford our politics right now. We've got to set it aside. We got to work on solutions. We've got to be focused on answers. We can't ask who's going to win and who's going to lose. We got to ask what's the right thing to do. And that's the only question when it comes to health. And we just had an election in Manitoba, and I know how central healthcare was. Canadians care deeply about these issues. And I think the only thing they want to see us talking about are solutions. And that's certainly the basis in which I'm engaging with Quebec. And I would say that the Minister of Health in Quebec and I have had great conversations on that basis. And I'm extremely optimistic we're going to get to a successful agreement.
Great, thanks so much. I'm also wondering whether there's a time limit on this funding offer.
Well, this agreement is for 3 years. But this is part of a 10-year plan of collaboration. And so there's an opportunity at the end of 3 years, as we discuss this, and I say this is going to be a conversation that Minister Dix and his colleagues and I and the members who are here will be having with the province regularly. There's an opportunity to look at, okay, what does that next 3 years mean? And to take a look at where the success is and how we can adjust and how we can better work together. So it is overall, it's 10 years, but this plan today that we're talking about is 3 years.
Great, thanks so much.
Thank you, everyone. We'll now move over to questions from journalists attending on Zoom. On va maintenant passer vers les questions sur le Zoom. Over to you, Anne, please.
We'll now proceed to questions from journalists on Zoom. If you are a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and the media outlet you are representing before asking your questions. Si vous êtes un journaliste et désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et une question de suivi. Sauf si je l'ai dit, veuillez indiquer votre nom et le média lequel vous représentez avant de poser votre question. Alors, la première question nous provient de Laura Osman.
Good morning, ministers. I have just one question for you about your meeting with your counterparts in PEI. I'm just wondering what you're hoping to accomplish there and what your goals are. You mentioned the health human resources issue, but you've got a jam-packed agenda for the fall. And what are you hoping to come out of this meeting with at the end of the week?
Well, thanks so much. In the 2 months I've had the opportunity to be health minister, I've had an opportunity to talk with all of my provincial and territorial colleagues. And so we've had a good conversation about what's possible. And I think we're going into the health ministers meeting focused on workforce issues, not just about new folks, but really also about retaining the people we have. And I can't say that enough. You know, we talk about the absolutely incredible work that healthcare workers have done. They need to be seen and recognized, and we need to retain them because we can't just add new folks. We got to keep the folks that we have. We have to look, though, at our foreign credentials. We have to look at pan-Canadian licensure. You know, in the Atlantic provinces, they've been able to work out a system where they recognize licensure, where people can move within the Atlantic provinces. I think we have to have a conversation about that. I certainly think interoperability, the way our data systems talk together, about knocking down those barriers in data. You know, it sounds kind of boring, but it's really fundamental. You know, if we understand the data and our systems can communicate with each other, I think that is going to make an absolutely critical difference. And in the foreign credential space, how can we reduce barriers? How can we set standards? So I think there's a lot of things that we're going to talk about. Certainly, it's an opportunity to talk about the other bilateral agreements. You know, this is phenomenal. I am so proud and happy to be here in British Columbia today. But we've got 12 more to go, and we got to get those done as soon as possible because we can't afford to wait. This work, this transformation, it has to continue.
Follow-up question, Laura?
I'll pass it on to my other colleagues. Thank you.
Thank you. The next question is from Katie DeRosa from Vancouver Sun.
Hi, Minister Holland. I'm just wondering if you could give your reaction on last week, BC introducing legislation to limit public drug use, basically eliminating or restricting drug use in public spaces, including parks, doorways. Critics have said that this is kind of a backtracking on the decriminalization agreement that the federal government made with BC in January. So what is your reaction, and does this bode well for other provinces who might be considering decriminalization?
Well, let me say that the crisis that is facing the country in terms of opioids is devastating, and that we have all seen in every part of the country its ill effects, and it rips at your soul. We're losing so many people. And I think the thing that's so hard about that is that, you know, once somebody's in that acute state, the amount of time that they have on this earth is probably not very long. And so we need to be really firmly focused upstream at avoiding people getting in those circumstances. I'm not going to get into you know, provincial jurisdiction about how this should or shouldn't be managed, but I want to say that, you know, we're having Minister Sachs and I are having really positive conversations with the government of BC about how we can help those that are suffering now, but most particularly how we can stop upstream people winding up in this space. Look, if you get addicted to opioids, you're at the end of a very long, difficult road. where there was a lot of darkness that got you to make that decision. And so we have to be really invested. That's why when I talk about mental health and the whole of government approach and the whole of society approach that we need to take on mental health. Yes, they're coming out of the pandemic. We've seen an absolute explosion in sort of mental health concerns. But I look at, and I obviously haven't gone through nearly as much as others, but I look at my own mental health. Up until the pandemic, I thought I was doing okay, and you go through something as traumatic as the pandemic, and it dislodges a lot of things that you didn't look at, things that you thought you were okay with that you hadn't fully explored and brought to peace. And so when we're walking through this world with one another, we have to be infinitely more compassionate than we've been, more understanding of how hard it is to be a human being in this world, and really be working upstream, because I know there's a lot of focus on that person on the street, and there should be. We should do everything we can to help them in their moment of suffering. But man, we are way too late. When that person is on the street and they're injecting, we're way too late in the journey. Our focus needs to be firmly upstream. Do what we can, everything we can for those that are suffering. But if we really want to do justice, we really need to be asking questions about those questions upstream.
Thanks. And I'll just maybe add that, the decriminalization pilot project is one very important tool in a large toolbox that we have to address the toxic drug crisis. And the point of decriminalization is to move to destigmatize people who use illicit substances. And the reason that that is so important is because we need every single opportunity we can garner to connect people to care and support. And if people are afraid of small amounts that they're carrying for personal use, if they're afraid that those those drugs are going to be confiscated or seized, or they may have to go find another supply, that puts them at great risk. And so that is the focus. That is our focus, is to work with law enforcement, to work with our municipal partners, to work with our healthcare providers, our physicians and nurses who are doing such a phenomenal job in an area of medicine that is one of the most specialized areas of medicine that exists today, to support them to do their work, to make sure that we can connect people to care. We have to balance that with the needs that other members of the community have when it comes to how we use public space. And we knew when we started this project that we would need to make adjustments along the way. And some of these adjustments are difficult, but we have to continue to work together across all of our partner groups, with people who use drugs, with law enforcement, with municipal partners, as we have been doing in the lead up to the successful application for exemption from Health Canada, and as we have been doing since decriminalization became in effect at the end of January. That's work we will continue to do together to make sure that we can provide people with access to the care that they need.
Follow up, Caddy?
Yes, please. And so with this funding, specifically for Minister Whiteside, how many, for example, how many more beds or treatment options can be opened up, and how many more additional overdose consumption sites can be added? Because those are two pieces that harm reduction advocates say are missing that need to be coupled with the decriminalization efforts.
Yes, and we've opened in the last number of years, we've went from 1 overdose consumption site in 2016 to 47 now. We are continuing to work with municipalities and health authorities on expanding access to those services. We're working on bringing in more inhalation opportunities into those services because we know the risk that inhalation poses. We are working, as Minister Holland identified, on upstream access to care through some of our child and youth mental health initiatives. We've opened in excess of 400 treatment beds since in the last few years, as well as many more treatment spaces. For example, working right now with St. Paul's on a very innovative approach to a seamless process of care. So all of that work is well underway, and these additional federal supports will support that work.
The next question is from Adam Zivo from National Post.
Hello, can you hear me?
Yes, we can.
Yeah. Okay, so quick question. Will any of this funding be used to tackle safer supply diversion?
Well, why don't I just tell you specifically what it'll be used for? There's, with respect to the mental health and addictions funds, as Minister Whiteside has just said, that's the rollover of the existing agreement. That's 246 million over 3 years, or $82 million a year. So the focus there is on things such as expanding Foundry, expanding treatment services, and expanding supports in the community, including harm reduction measures. The largest share of the money under this agreement will go to support nurses, particularly nurses in acute care. So that's 200, 250, and $300 million in each of the next 3 years of the agreement. That's 750 over 3, and that's the majority of the funds in the agreement. There'll also be, in addition to the mental health and the nursing proposals around diagnostic care, around wait lists, and around digital care, all of which and supports the kind of supports we put in place, for example, in cancer care, to recruit doctors there. So that's what's in the agreement, and those are some of the details. Have to go if you want more questions on the details, those are them, but that's what the agreement covers.
Yep, sounds good.
Any follow-up, Adam?
No.
Perfect, thank you. So last call for questions on Zoom. Dernier appel pour des questions sur le Zoom. This concludes today's events. For further questions, please contact the Media Relations team at Health Canada or at the BC Ministry of Health. Ceci conclut l'événement d'aujourd'hui. Pour toute question complémentaire, veuillez contacter l'équipe chargée des relations avec les médias à Santé Canada ou au ministère de la Santé de la Colombie-Britannique. Bonne journée à vous. Have a good day.